The non-utilization rate for deceased donor kidneys is increasing every year, currently more than 1 in 4. In 10% of these cases, one of the 2 kidneys is transplanted, which gives us an opportunity to analyze the potential usability of the kidney not transplanted. We performed a retrospective, single-center cohort study on adult deceased donor kidney transplants from 2001 to 2023. During the study period, we performed 395 single kidney transplants in which the mate kidney was not used, and 2,303 controls in which it was. Reasons for mate kidney non-use were mostly symmetric and predominantly due to logistical concerns or lack of an appropriate recipient. For the single group, mean donor and recipient ages were 51 and 60 years respectively. Mean KDPI was 73% and cold ischemic time was 26 hours. 70% were imported from outside our region. Delayed graft function was higher in the single kidneys at 35% versus 30% in the control, and creatinine levels at 1 year were also higher at 1.77 milligrams per deciliter versus 1.61 in controls. The incidences of primary nonfunction and thrombosis together were greater in the single kidney group at 5.1% compared to 2.8%. Median patient survival was 11.6 years for the single group compared to 13.5 years in control, and the death-censored graft survival rate was also shorter in the single group at 11.6 versus 19 years. Despite these differences, the median survival of both groups is more than double the 5.5-year mean survival on the waiting list. Additionally, both patient and death-censored graft survival rates remained comparable between the groups up to 5 years post-transplant. These findings suggest that many mate kidneys are being inappropriately doomed to non-use and provide a superior alternative to remaining on dialysis. We have previously published that rates of early graft loss and primary nonfunction are more than doubled with prolonged cold time. Minimizing cold time for these hard-to-place kidneys to maximize their functionality will require improved collaboration between OPOs and transplant centers, as well as expedited allocation processes. Identifying kidneys with a high likelihood of non-use early and offering them as open single or dual kidney offers to centers who frequently use these organs may reduce ischemic time and improve utilization and outcomes.